So Trump just signed the HALT Fentanyl Act into law, and I need y'all to understand why this isn't the win as they're selling it as. So this law permanently classifies all fentanyl-related substances, even ones that haven't been invented yet, as Schedule 1 drugs. So this means they're considered to have no medical use and are treated like heroin. But here's the kicker. Researchers now have to go through ridiculous red tape just to study these compounds. So if there's a fentanyl analog that could actually be safer, less addictive, or more effective for patients in pain, too bad. Science doesn't even get a chance to look. So now let's talk about what this means for clinicians, doctors, nurses, pharmacists, respiratory therapists, the people on the actual front lines. This law makes it harder to develop new pain management options, especially for patients with cancer, sickle cell, or complex post-op pain. Fentanyl and its analogs are used every single day in hospitals for anesthesia, trauma care, and ICU sedation. Without this law, clinicians are walking a very tighter line. There's also confusion here. So not every clinician has legal training to instantly know which analogs are now banned or how similar they are to medications we've used safely for years. So that leads to fear of liability and forces clinicians to avoid effective treatments out of caution, not because it's clinically appropriate. And when we do avoid fentanyl out of fear of politics, we end up using less effective or riskier alternatives. So that means undertreated pain, longer hospital stays, and worse outcomes, especially in under-resourced or rural settings where clinical options are already limited. This law does not stop overdoses. Illicit fentanyl is already illegal. What this does is tie the hands of the very people trying to save lives, researchers and clinicians alike. So we've seen as clinicians what happens when pain is ignored, when fear drives care decisions, and when science is sidelined. This law doesn't fix the opioid crisis. It just deepens the gap between public health and policy. We need harm reduction. We need science-based laws, and we need to stop punishing people for being sick. Addiction is a healthcare issue. Let us treat it like one.